And today with us is Dr. John Meadors. You know, we have a chance now to meet new people here, and we get to meet the movers and shakers of the beauty business, and today is no exception. John, thank you very much for joining us.
Thanks for having me.
It's great to have you here. You told me about this great technology. I just heard about it. I want to hear more about it. First of all, where are you from, John?
So I'm from Alpine, Utah.
Really?
Yes.
And what got you into body contouring, John?
So I had a surgical center in California in 2003, and I was renting out my space to plastic surgeons and saw liposuction done for the first time. And I thought there must be an easier way to remove fat from the body. And
Good for you.
So that's kind of in the back of my mind. And 10 years later, I acted on it. It started in 2013.
Now, you're a doctor. Are you an engineer?
No.
Okay. What kind of doctor are you?
I'm a chiropractor.
Okay. And you got in the fat business, body contouring.
Correct.
Which is what I'm in.
Sure.
And what did you invent? What did you develop?
So basically, I hired 5 different engineering companies to help me invent a device that would immediately take fat off the body. And 4 of the 5 failed. I finally found a gentleman that was 80 years old that knew all about ultrasound, and it took him 2 years to get the engineering down where we could get this very specific frequency and the way we're delivering the frequency to affect the cell membrane of the fat cells.
So you kill the fat immediately. You said the word immediately.
Correct.
So if I come in and I get in this wonder device you have, I'm going to get skinny right away?
Correct. So we like to do a before photo, treat you for 40 minutes, do an after, and we can see an immediate change in your body.
Well, a couple questions. Do I pee out the fat, or where's the fat go?
Well, basically, we liquefy those fat cells, and it's going to be processed through your lymph system and out your urine.
Interesting. Okay, and does it hurt?
So that's the very best part of it. Everybody asks about pain. We have 0 pain involved with the treatment. No downtime, no pain.
Now, wait a minute. I've used ultrasound to minimize fat with some of the technologies. I'm not going to mention their name now. And I've had it done, and it hurts like the dickens. You're telling me you have ultrasound, I can lose fat on the moment you treat me, and it doesn't hurt?
Correct. So basically, the old technologies were using heat, typically around 140 degrees, and we're not using heat at all. Our temperature on the skin is 92 degrees. So the sound waves we're using are causing this disruption in the fat cells. So we're not using heat, so we're not having any pain involved in the treatment.
So why does the adipocyte die?
So we're vibrating those cells and creating little air bubbles inside that cell, and that creates this pressure, and it just causes the
So
membrane.
you blow them up?
Correct.
So you're not melting them?
No.
You're creating bubbles in my adipocytes, and they explode.
Correct.
Now, I want to make it perfectly clear to everybody, I have no investment in this company. I just heard about it here at ABAM. I wish I did own the company from what I'm hearing here from John today. I definitely want to have the treatment done. So do you have the machine here?
We do. One of the things that we love to do is demonstrations. You know, talk's cheap, and we want to show people exactly what we can do for them. We have a lot of photos, and here's some photos here that we can show you. Basically, this is a before photo, 40 minutes later, where the person did not have any time to diet or exercise, and they can see a change immediately. This is 1 week later, and then this is 2 weeks later. So you can see a drastic change in her body. There's no way she could diet or exercise this abdomen off to this in 2 weeks without the treatment that we're doing.
I would agree with that.
So basically,
that's remarkable.
We go to conventions. We treat about 20 to 25 people at a convention, take their pictures. Today we treated some people in their room. We'll show some pictures of somebody that was very, very thin, and you can see a change immediately.
Can I sign up for tomorrow or the next day or the next day?
We can do you right now when we're done.
Right now?
Right now.
Well, I have to go to a special dinner here.
Yeah, after dinner's not a good time for a treatment.
No,
Tomorrow.
Not at all. But I need about 10 or 12 of these treatments. So how
Probably
much
6.
How much does a person lose? Do you quantify it by percentages or inches?
Well, right now we're not sure. It just depends on the size of the person. So, you know, a smaller person is going to lose less. As you can see,
Sure.
with the bigger ones, we get the drastic picture changes.
How about intra-abdominal fat? You know, the beer bellies, the fat that's in our omentum, the stuff around our liver and our pancreas and our intestines. Can you get inside of my belly?
We're not quite sure what's going on deep inside, so we're doing research, and we'll find that out over the next couple of months.
Fascinating.
Using MRI technology and testing blood to see what's really going on.
This is really exciting. I'm glad I met you, and I hope I can get on that list to be treated tomorrow. Are you going to be down in San Diego by any chance at the Aesthetic Society meeting?
I will be. We'll be there treating patients. So we'll have 2 or 3 tables there going all day long.
How would you like to speak at the Aesthetic Innovation Summit?
I'd love to.
Well, as the co-chairman myself and one of the founders of it, I'd love to have you up there on a panel on
I'll
body
be there.
contouring. You promise?
Sure.
Deal? Great. Okay. Go Ducks.